What I'm going to demonstrate today is extremity manipulation. I'm going to be using both diversified and activator technique on areas of the shoulder, elbow, hands, hips, knees, ankles, and feet. First, what I'm going to do is ask Ron to sit right here. The shoulder joints in the body are the most dynamic mobile joints, but for mobility you sacrifice stability. So this is an area of the body that we see a lot of conditions, a lot of injuries with. So first thing we always check is range of motion. We want to see the full, and this is called passive range of motion, which I am performing on this joint segment. Then I'll ask the patient to go through an active range. Raise your arm straight up in the air, come down and go an extension. Beautiful. Go out forward. Okay, beautiful. So you want to see full range of motion. Once I understand the areas that are restricted, which there's multiple joints that permit the movement of the shoulder, you have the sternoclavicular, your acromioclavicular, your glenohumeral, your scapulothoracic, your first and second rib. All these contribute to the biomechanics of the shoulder. With this, you have the shoulder capsule, you have multiple submuscles, which are your supraspinatus, your infraspinatus, your teres minor, your subscapularis, you have your deltoid muscle. So just understand the complexity of this joint and its involvement in all your day-to-day movements. Now, the first adjustment I'm going to do is called a diversified technique. It's a very gentle technique where I'm actually placing movement on the glenohumeral and the acromioclavicular joint. And relax. Beautiful. Beautiful. Another way to also adjust these joints is through a technique called an activator. Many a times when a person has a frozen shoulder, or what we call adhesive capsulitis, we'll start with very gentle technique because they are unable to move the shoulder at all. And we'll adjust the acromioclavicular, sternoclavicular, glenohumeral. Stand here for a second. And understanding the shoulder joint, obviously we always like to address the elbow, the wrist, and the digits. There's different types of movements and altered biomechanics that can occur in these joints. Usually how we go about analyzing these is I supinate and pronate. I want to feel the movement of what's called the radial head, and then the olecranon, or the ulnar, I feel how it's cavitating into the humeral joint. So Ron is showing a little restriction on the radial head, and I'll just put a little impulse in there, and a little bit of restriction in the 8 carpal bones of the wrist. Beautiful. And I'm going to check his opposite side. I'm going to check the movement of the ulnar, which feels very good. And I'm going to supinate and pronate to feel the radial head. Once again, his radial head's a little restricted. Check his carpal, a little restricted there, and then adjust his digits. And there's adjustments of the upper extremity.